Welcome back to AM Northwest. The holidays are almost here. If you want to look great for all those family pictures, there is still time. Here to share some important information about injectables, we welcome back Portland face doctor, Dr. David Magilke, along with his clinical nurse, Lauren Pearson. Good to have you with us.
Hey, thank you very much.
Absolutely. Let's talk about injectables because they're all different kinds and they're all different ways to be used, right?
You know, it's a great topic because I think right now there's so much on the media, there's so much online, and it's very confusing for people. I mean, people talk about getting injections. If you boil it down, it's actually quite simple. There's basically three different types of injections that are available right now. One is one that people are very familiar with, and that's Botox.
Sure.
There's also other brands like Dysport or Xeomin. And what these injections do is they relax muscles. So they help to make you look less angry, or they sort of make the lines between your eyes sort of disappear.
Yep.
And so they're basically for lines that are expression lines, and lines that are when you're making you know, either angry or sad.
Right.
The other types of injections are fillers, and you know, probably one that most people remember is collagen. That was one of the first ones. Now there's a whole slew of them: Restylane, Juvederm, and all of these basically fill in lines. They can also help sort of do structural support. So as we age, we naturally lose some fat or some fullness in our cheeks.
Oh, right.
So you can actually do a filler, and it could basically bring back that sort of blush bar that, you know.
Oh, look, this is great.
Yeah, and it's something people don't really think about as they're aging, but if you give people back that sort of volume in the mid part of their cheek, they look healthier, they look younger, and it just gives you an overall better shape to your face.
It can also take away volume.
Yeah, it can, yeah. So
like under the chin volume.
Yeah, and that's the third injectable, and that is the newest one that just came out is called Kybella, and it's interesting because there are a lot of people who are just adamantly against surgery, but like to improve their necks. And
right, because as we get older, it sags.
Yeah, and what Kybella does is it basically dissolves the fat under your neck. So, yeah, and it does in a non-surgical procedure, so you can actually have somebody like one of our clinical nurses inject it. Sometimes it can take more than one procedure, but over time, it gives you a permanent removal of fat under your neck.
And Lauren, this isn't about just buying a product, right? It's a medical procedure, and someone needs to know what they're doing.
Yes. It's important to have somebody who's licensed and credentialed and knows what they're doing.
Right. And isn't it also artistic in a way? Because you need to know how you're dealing with each person's face and bone structure and all of that, right?
Oh, absolutely. Everybody's face has the same basic structure, but everybody's muscles move differently, everybody's faces age differently, so it's important to look at the science aspect and the artistic aspect of it.
And then there's the medical aspect of it.
Yeah, I mean, I think that's one thing that people really need to remember is all of these injectables are, you know, medications, if you will. I mean, they're things that have to be prescribed by a physician. And sometimes you'll go into a spa or something like that, and behind the scenes in a spa, there is a doctor who is ordering and who is prescribing these. Our office is on a hospital campus. It's a medical office, and primarily we are there to take care of people, and the people doing the injections are medical professionals. Lauren's a great artistic injector, but she's also works in the ICU. She's an ICU nurse, so she can not only give you a great aesthetic result, but she can also take care of you. She knows how to do injections. She knows how to do them safely, and also to take care of people if they've had any issues.
Is there any kind of downtime to some of these injectables?
Not very much. There's always the risk for bruising, a little bit of swelling in the initial couple of days. But as far as downtime, most people can do them on a Thursday or a Friday, and by Monday be looking great and ready to go back to work.
And if someone comes to you, you can give them advice on the best injectable to get, right?
Oh, totally.
They may have an idea. I want this taken care of. You may say something else needs to be worked on.
Yeah,
too.
I mean, it's kind of like commissioning somebody to do a painting. I mean, you know, you come in there, you tell them what you want, and then they choose what types of paints to use. And I think coming in there with that open mind makes it so that you can get a really great result.
Absolutely. We want to tell folks if they'd like to find out more about the Portland Face Doctor and all the injectables available, contact David Magilke. The number we'll be putting on our website at katu.com. Thank you both very much.
Hey, thank you very much.
Appreciate it.